Hi everybody, this is Danny, student nurse, Neuro.com, and today I'm going to be going over myasthenia gravis. And this review is part of a project I have to put together in order to pass Med-Surg 3, and thus, nursing school. So let's get started. Myasthenia gravis, what is it exactly? It is a chronic progressive autoimmune disorder that causes weakness and fatigue of the striated skeletal muscles. Why does this happen? Well, in individuals with myasthenia gravis, there is a significant reduction of acetylcholine. Acetylcholine is a very important neurotransmitter. We're going to get to that. But first, let's talk about this guy, the thymus gland. The thymus gland is present at birth, right here below the breastbone, and it is active until about puberty, at which time it stops producing antibodies and it begins to atrophy. It's thought that in people with myasthenia gravis, the thymus does not stop producing antibodies well past puberty. And why this becomes a problem is that we have here, in this lovely illustration, an axon. And whenever you want to have a muscle contraction, it's going to send a signal through the synapse to here, where the signal is going to release acetylcholine. In normal individuals, acetylcholine will then bind to its receptor sites, and you'll get a muscle contraction. However, in people with myasthenia gravis, the receptor sites are already taken up by the antibodies that were produced by the thymus gland. And to make matters worse, we have cholinesterase, which is an enzyme that's going to break down acetylcholine. So essentially, you have a lack of acetylcholine, and what acetylcholine is present is not able to bind to the receptor sites because they're already taken over. Thus, difficulty having a muscle contraction. Because this is an autoimmune disorder, there's no real way to prevent it, but there are some risk factors that we can be on the lookout for that might predispose a person to developing this disorder. That is women, ages 15 to 35, men, ages 40 plus. The ratio between men and women is 3 to 2. This disorder is marked by periods of exacerbations and remissions. Things that are going to predispose the individual to developing an exacerbation are infection, stress, fatigue, cathartics, which are your laxatives, and heat. So you want to teach these patients no sunbathing, no saunas, no hot tubs. Now that we kind of have an idea of what this disorder is, let's look at the clinical manifestations. So what you're going to see is progressive weakness and fatigue of the skeletal muscles, an inability to maintain position without support, ptosis, diplopia, and they can't maintain an upward gaze, dysphagia, and respiratory compromise. This is because those muscles that we take for granted, that the intercostal muscles and our diaphragm to help us breathe, in individuals with myasthenia gravis, because they have such weakened ability and impairment with their muscles, they're having difficulty inhaling and exhaling. This is something that's very important and that we're going to go into further a little bit later. In order to help you remember the clinical manifestations, you want to remember weakness, W, weakness in the face, arms, and legs, E, eyelid drooping, ptosis. A, ability to emote is impaired. They're going to have a very sleepy-like appearance because even these muscles in the face just becomes very difficult for them to move them. K, they're going to be choking and gagging, so we're going to be worried about aspiration risk. N, they have no energy, lots of fatigue. E, extraocular muscle involvement, the strabismus, which is going to be your cross-eyedness. S, shortness of breath, and S, slurred speech. Remember weakness, in case you get one of those select all that apply questions. So now, these are the symptoms you're seeing in your patient. Do they have myasthenia gravis? We don't know. We're going to have to test for it. So then, you're going to perform the Tensilon test. This is the gold standard for identifying myasthenia gravis. What happens is you start an IV on your patient, and then they are injected with edrophonium. And you want to teach your patient that when they receive the injection, their stomach might become a little upset, their heart rate might increase. With this test, you're going to have the individual perform something such as repetitive arm moving, standing up, sitting down, walking, trying to say as many words as possible. When they begin to fatigue, they get another injection. And if over the course of the test you notice that every time they are injected, their muscle endurance increases, that's a positive test, which means they do have myasthenia gravis. Other tests that can be performed are electromyography, myomuscle, EMG, CT scans of the thymus, and thyroid studies. So now let's talk about the nursing care, the collaborative care, and some complications you might see with myasthenia gravis. Some nursing diagnoses related to this disorder are impaired gas exchange related to ineffective breathing pattern, fatigue related to increased energy needs from neuromuscular involvement, and risk for aspiration. When you think of myasthenia gravis, really focus in on the fact that these patients are experiencing severe muscle weakness. So what are we going to be worried about? Well, with those intercostal muscles and that diaphragm being impaired, impaired gas exchange, and fatigue. When we think of their ability to swallow, that takes a muscle. Risk for aspiration. Collaborative care, the nurse is going to work with the physician as well as PT and OT to really help these patients optimize the most out of their activities of daily living. They're also going to be prescribed cholinesterase inhibitors. Pyridostigmine, Mestione, is the first line of medications prescribed. Some other therapeutic procedures they might be getting is plasmapheresis, irradiation, respiratory and nutritional support, and possibly a thymectomy, which would be the removal of the thymus. Nursing management, you're going to focus on assessing and maintaining that airway and assessing their ability to swallow. These are two huge important things you need to be on the lookout for, especially when you're working with a patient who has muscle weakness and fatigue. We don't want to cause an exacerbation. You're going to cluster activities in the morning and allow for frequent rest periods. You're going to teach this to your patients as well. If you have something important you need done, you want to do it in the morning when your muscles are really at their highest peak of the day. You're also going to teach the patients taking Mestione to take it with food to prevent GI upset. When you give this medication, you're going to give it, and then within 45 minutes of giving it, you're going to give them their food. This is because you're going to take advantage of that medication's effects, and they're going to have the strength to really chew and swallow their food, which will reduce the risk of aspiration. You're also going to teach these patients the importance of maintaining therapeutic levels with this medication. This is key to reducing their risks of having an aspiration. Going back to our nursing diagnoses, they have to be able to breathe, they have to be able to swallow, and of course, as part of daily life, they want to be able to get around and be involved with people, their family, friends. Monitor their albumin levels, provide small, frequent, high-calorie meals because they fatigue so easily, and because we're trying not to exacerbate the condition, we want to give them small meals that they'll be able to chew up and swallow without the risk of an aspiration. Some medications you're going to be administering are the corticosteroid prednisone, the immunosuppressant azathioprine. You can also give IV, IG, immunoglobulin, and again, Mestione. Some of the complications of myasthenia gravis are fulminating severe myasthenia gravis, which is a rapid onset characterized by severe weakness. You will see early respiratory involvement. They're going to have difficulty just struggling to even breathe in and out. It's caused by myasthenia or cholinergic crisis, and the response to treatment is often poor with very high mortality rate because of the respiratory failure and aspiration that occurs with this. The other complication is a myasthenic or cholinergic crisis. I'll break it down for you right here. If they are having a myasthenic crisis, there are not enough meds on board, they are not in therapeutic range. It's going to be, you're going to see signs of weakness, incontinence, fatigue, and hypertension. It's treated with a cholinergic. One of the medications given is pyridostigmine, Mestione. Again, if it's a cholinergic crisis, there's too much medication on board. Your signs and symptoms are nausea, abdominal cramps, diarrhea, hypotension, and increased respiratory secretions. You're going to treat it with an anticholinergic, atropine. It's going to go ahead and help dry up all those secretions for you. So that does it for me and this presentation on myasthenia gravis. I hope you enjoyed it. If you did enjoy it, that's great. I'm probably never doing another video like this again. But if you did enjoy how I broke down the content, go ahead on over to registerednursern.com, where you will find Sarah. She does videos on absolutely everything that's covered in your classes. She breaks it down in a way that is easy for you to retain and utilize on your exams. She also has a nifty little quiz at the end full of NCLEX style questions and select all that apply, because we all know we need more help with which orange is the most orange. But again, that does it for me. Hope you enjoyed it, and maybe you'll see me again.